Hello, my name is Dr. Jonathan Burg. I'm president of Cornerstone Wellness. I'm an internist, a physical medicine and rehabilitation specialist as well. And today I'd like to talk to you about, over the next 10 minutes or so, a topic that is so frustrating for so many patients. The name of the talk I'm going to do today is Why Diets Don't Work and What You Can Do About Them. I'd like to show you the technology we've developed, the nutritional approach we've developed to weight loss, I should say fat loss, that your physician is using, sort of summarize it over the next 10 minutes. Nobody's had more trouble keeping her weight off than poor old Oprah. I mean, up and down and up and down, and every time she's up, it's in every newspaper you could see as you're checking out the supermarket. The reality is this poor woman has more money than God, but she can't keep her weight off. She can have every spa diet, trainers, you name it, but she can't do it. So she can't do it. How are you going to do it within your means? Important point I want to make. Body fat is the important thing. Weight really doesn't matter so much, particularly with regards to your health. Your body could care less how much you weigh. What it doesn't like is excess body fat, okay, other than your knees, of course, which care how much you weigh, but everything else is related to body fat. Here's a test that was done. It's called a DEXA. Some of you may be familiar with it. It was a test they used to measure osteoporosis, and as you can see, the two fellows here have the same exact BMI, body mass index. However, one has a lot more body fat in yellow than the other one, 4 times more fat. But you could never tell by looking at them, even with their clothes off. You couldn't tell how fat this guy is. Now, this guy's at much higher risk for things like heart disease, diabetes, hypertension, blood pressure, elevated blood pressure, and so forth. It's about the body fat. That's what we want to get rid of. We really don't care what you weigh, as long as you're lowering your body fat and you're keeping your muscle. The way we measure body fat and muscle, and metabolic rate for that matter, is with this very advanced device, even though it looks very simple. It was developed at the University of Southern California. What it does, it sends electricity through the body, okay? You don't feel it at all. It's a very small amount of electricity, and it's measuring exactly how much muscle fat you have in your body, and then recording it on the web. Okay, only for your eyes and your doctor's eyes only. Okay, you get a username and a password so you can actually look at it. It's developed at USC. It's extremely accurate. It's the most accurate bioimpedance device out there. And what it also does is it takes your metabolic rate and puts that into your meal planning program. So it's the amount of calories you're going to get is specifically determined by your metabolic rate. It does you no good to be on the same number of calories. Say you're 200 pounds, to be on the same number of calories as somebody who's 800 pounds. Obviously, you're going to be on a different number of calories, but a lot of the programs out there put everybody on the same exact calories. Makes no sense. So we're customizing it to you. As well, this is your customized dashboard. What you see on the right-hand side is with this pie graph would be your pie graph, and in green it shows your lean body mass or muscle. In yellow, that's your normal amount of body fat we want you to keep, so 18 to 26% in a woman, 12 to 18 in a man, and red is the excess body fat. That's what we want to get you rid of in you, and when you do that, your health will improve. You will drop mega sizes when you lose body fat as opposed to just weight. If what you're losing is fat, you're going to lose dress sizes much faster than if you lost that amount of weight, because you'd be losing muscle as well if you're not watching your muscle mass. Body fat percentage on the left in the orange number, weight in yellow, and lean body mass. It's very easy to read, very simple to follow, and you can follow this at home, wherever with your computer. If you don't have a computer, that's fine. We can do all this on paper, and also at the office you can check up on yourself and so forth. It's just a good way to follow. A lot of feedback here. This is the website. The website is basically a way for you to record your meal plan and do your exercise. You get some articles, some educational materials. And here's the meal planning. Breakfast, lunch, dinner, snacks. What you're doing is you're entering in this particular guy's case, he wants to have oatmeal for breakfast. And what it's going to do is tell you exactly what nutrition is in there as far as protein, carbs, calories, because that's what we want you to follow. We want you planning what you're going to be putting in your mouth. That's the only way to diet. Anybody who tells you any differently doesn't know what they're talking about. You need to plan ahead. You need to prepare. So this guy's picking out the oatmeal, cinnamon spice, and he's putting it in there, and he's seeing how much protein, carbs, fat, calories are in there, including fiber, salt, and so forth, sodium. And he's putting when he ate it, and he's putting what his mood is. Most people get happy when they eat oatmeal, I think, because Mom used to give us oatmeal. Okay, and what you're going to see here on the right-hand side of the screen, after we go through again the calories, total fat, carbs, etc., is a little governor in red. That's how many calories you're allowed at the top. Then that shows how many carbs we want you to stay at or under, and then how much protein we want you to get at least. And if you do that, you're only going to lose fat. You're going to keep your muscle, and that's going to maintain your metabolic rate. so that you will keep burning calories at the same rate you did before you lost 10, 15 pounds, of which all hopefully will be fat. Now you might lose a little bit of muscle along the way, that's to be expected, but our goal is to just lose fat. Here he's going to put in, he or she I should say, is going to put in eggs, and same thing. Okay, you just log it in. It's very simple to use. And again, it's all based on your body composition, your lean body mass, your body fat. Now what about activity? Well, there's fun stuff you do. You don't have to go to a gym. You don't need to jump around in those silly outfits. You can go out, in this particular guy's case, he's going to go backpacking. Make it fun. Take the family along, okay? It's not about, getting on that treadmill an hour a day. That's boring. Burns you out. 60 minutes on backpacking, okay? Moderate backpacking. And there it is. Shows how many calories he burnt doing his moderate backpacking. And then he's going to also go do some automobile repair. There's everything in here. There's childcare, there's archery, there's badminton, all kinds of fun stuff. Not that automobile repair is fun. At least not for me. Okay, 30 minutes, there you go. That's how many calories you burnt. All right. Next, we move on to the resistance training. Very important. Where we want you to keep muscle. Part of keeping muscle is by using your muscles. And this is stuff you can do at home with a balance ball, some bands, a mat. You really don't need anything in the way of weights to speak of. And these are simple exercises. He wanted to work on his abs. Here's all the ab exercises. Beginner, advanced, intermediate, whatever you are. And there you go. There's a picture of how to do the exercise with some videos, and there's a written explanation of how to do it. So you can just follow along. You just print these out or just keep them on your computer right there. Very simple, a nice way, some nice, fun, sort of techie stuff to work with. Okay. The last thing I'm going to talk to you about is walking. This is our calorie mapping program. You put in your zip code, and there it shows a map, a Google map. And this is in Midtown Manhattan. You could do it when you travel. You can just put the zip code in where you are, and you could zoom in on the roof of your hotel if you want to use the satellite feature, Google Satellite. And this person's going to go for a little bit of walk around Midtown Manhattan. So you're going to click on each corner. They make a turn, and it's very simple. Boom, boom, boom. Again, you do it ahead of time, and there you go. Okay, and did a nice loop around Midtown Manhattan, probably right by Macy's. Okay, duration, distance. Shows there 0.82 miles, 10 minutes, and that's how many calories I burned, 69 calories. Very simple, fun to use. Okay, now let's move on. Okay, the key to maintenance of muscle, I'm going to say this a couple times. The key to maintenance of muscle, loss of fat when you're losing weight is protein. There's no other way to maintain muscle while you're losing fat. Protein keeps you full. That's the other thing. Protein is it's nature's own appetite suppressant, okay? It's a way to maintain muscle during weight loss, and you need a lot of protein. Turns out the most recent studies tell us a lot more than what we used to think. You need about 1.5 grams per kilo, or easier way to remember it is 1 gram of protein per pound of muscle, okay? So I, again, would be on 150 grams of protein a day because I'm 200 pounds. And I have 150 pounds of muscle. What we want you to do is increase the amount of protein you're eating in your meals, but even with that, it's very, very difficult to get enough protein. So because of that, we suggest a protein supplement, but not just any type of protein supplement, not a big bag of whey or soy protein. What we want you to do is a meal replacement, and what meal replacements do is they replace one or more meals, okay? What all the studies have shown us, all the medical studies that have ever been published have shown us that meal replacements are 2 to 3 times more effective than usual care diets like Weight Watchers, Paracone, South Beach, and so forth. They provide long-term insurance against weight regain because you're getting more protein, more nutrients like vitamins, minerals. There's marked improvement in things like blood pressure, cholesterol, blood sugar. It's phenomenal. This was created actually for diabetics. Ours was, and it's extremely convenient. What's more convenient than throwing some powder in a blender along with some milk, shaking it up, putting it in a blender, maybe throwing some ice in there, maybe half a banana, pop it in and drink it, and you're good to go. Okay, that's breakfast. You don't have to come home to any dirty dishes. Less expensive. It's much less expensive than eating in a restaurant. It's less expensive than buying food and making a meal at home. I'm not going to go into the products here, the supplements that I formulated. Suffice to say, this is the premier meal replacement on the market. It has the highest protein, highest vitamin, mineral content, 800 units of vitamin D3. I could go on and on. I specifically created this for satiation, for satiety. You take one of these shakes, you won't be hungry for 4 or 5 hours. It'll make dieting that much easier. Plus, you're going to maintain that muscle mass. And omega-3, along with something called Metasis, which I won't go into. But if you'd like to, you can scroll down on this sheet, and you'll see those videos that pertain to those particular products and supplements specifically. Accountability, so important, and that's why we make this a medical weight loss program. You can't get these supplements, for example, online or in a store. You need to go to a physician, because a physician should be helping you with your weight loss. If your physician isn't currently helping with your weight loss, ask them and potentially tell them about this program if they're not already using it. Accountability, the way it works in this program, the Cornerstone program, is you get regular follow-up. You'll come in, see the doctor on a regular basis. He or she can look on the computer, see what you're doing, so you have somebody kind of big brother looking over your shoulder, seeing how you're doing as far as your measurements, your meal planning, making sure you're staying on track. You get regular body fat testing. They're going to look at your food log, your exercise plan, and then there's a maintenance program. Once you're done with gotten down to where you want to be, there's a maintenance program to keep you there. So, because the reality is that we all get, Thanksgiving, Christmas, they add up. Here I'm going to just show you two patients very quickly. I'm very proud of this young man. He was 16 years old when he went on the program. He dropped from 289 down to 160. He lost very little in the way of muscle mass, and he's done phenomenally well. He's kept it off for years now. Again, this woman from Tallahassee, Vanessa, 440 pounds down to 220 pounds. She halved her weight. Those are her pants that she's wearing there when she's lost all that weight. She's come off 7 medications, including insulin. She's kept it off. She lost very little muscle. I was amazed at how little muscle she lost as she lost the fat. Insanity has been defined as doing the same thing over and over again, expecting a different result. The way most people in this country, the way most people in the world diet could be described as insane. Doing the exact same thing, going on a very low calorie diet, not getting enough protein, not staying on top of things, and then of course gaining it back. Why? Primarily because they lose muscle. They don't get enough protein, they don't get enough calories actually, and so their metabolic rate drops. When their metabolic rate drops, this is called cycling, when their metabolic rate drops, they're burning less calories, so when they go off their diet, they're much more likely to gain it all back. But even worse, they're gaining back fat because they lost muscle. So their body fat has actually gone up rather than gone down. We don't want you to be insane. We want to cure the insanity. The program works for kids as young as this little girl. She's 18 months there. She's been on the shake since she was, I think, 11 months old. She's never had an ear infection, never got sick a day in her life, and her parents attribute that to the program. So if you'd like to hear more about the program, ask your doctor about it. If your doctor is does not currently have this in their office, you can refer them to the website, which by the way is www.cornerstonewellness.md. You can go on the website, learn more about the program, learn more about the products and other aspects of the program in depth. And I want to thank you again for your precious time, and I look forward to seeing all of you in the future. Thank you.